The following portion of Daytime is sponsored by Tampa General Hospital.
Back pain is one of the most common complaints doctors hear from patients, and for those with chronic back pain, surgery may be the best option. Here to talk about who makes a good candidate for spine surgery and the options that patients have is Dr. Puya Alikhani, Director of the Spine Surgery Program at Tampa General Hospital and USF Health. Thank you so much for being here, Doctor.
Thank you for having me.
It's good to have you here. Tell us what some of the main causes are of back pain and when it's time to see a physician.
Well, back pain is something that affects almost everyone in life. A lot of people who go to see their doctors because of back pain, and it just could be as simple as a muscle strain because of the daily activity, or something more complex. So majority of the back pain will resolve by themselves in few days with conservative treatment, over-the-counter medication. But if the pain persists despite those conservative treatment and rest, or it's causing pain in the legs or arms, or they have some bowel or bladder changes, that's the time that they need to see a spine specialist or a neurosurgeon.
And if it's deemed that surgery is the best option, I'm wondering what surgical interventions you have now, given that technology has come such a long way in the last several years.
The first option is not always the surgery. The first option is always the conservative treatment to see if we can help our patient without offering the surgery. And what we do, we have a specialized team of pain management and physical therapists. And 99% of the time, the pain gets better without the surgery. But in that 1% of the remaining, yes, we do have tools to offer them. As far as the technology goes, we are at the exciting era of spine surgery. We have access to the most advanced technology at TGH. That's including operating through the smallest incisions like your fingertip, which is through an endoscope that you really don't see any scar right after surgery, to using robot to put the screws in 1 millimeter precision, and to a big spinal deformity surgery. So we do have access to those advancements at TGH.
I'm sure that it varies, but generally, what does recovery look like for these patients, and what can they expect after surgery?
And this is the same question that I get from my patients.
Sure.
Because people think the spine surgery is like before. They spent days and days in the hospital with a lot of pain. Things have changed. With the tools that we have, which is advanced recovery pathway that we take with pain management, early mobilization, and the rehabilitation, majority of our patients go home the same day or the next day with minimal pain.
That's incredible.
So things have changed, and we are excited about it.
I know that it takes a team to care for patients. So would you speak to some of the other experts who help care for spine patients at TGH?
When it comes to spine care and taking care of the patient, TGH is the place. And the reason that TGH is the place is because of the team around it. I have a specialized team of people who help me deliver this outcome. This involves pain management team, physical therapy, advanced practice nurses, and specialized nurses who know how to take care of these complex patients. We also have home health and transitional medicine, and they see the patient right after surgery, and they help them transition to home as an outpatient, so the patient doesn't feel lost after the surgery.
As an academic medical center, how is TGH leading the way in this field as far as research?
TGH and University of South Florida are true center of excellence for spine surgery. We have a team. We just don't operate. We study our outcomes. We innovate new techniques, and we train the next generation of spine surgeons. When we study our outcome, we innovate new techniques that it becomes common practice elsewhere. And because of our mission, which is academic mission, we are not just following a standard. We are trying to define new standard in spine care.
Dr. Alikhani, thank you.
Thank you for having me.
Really appreciate it. If you would like more information, visit tgh.org/minimally invasive spine surgery. We'll be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.